But the reality is there's so much that can be done that would prevent the need for someone getting to that point. And the same thing goes with the fillers that we're doing. There are ways of maintaining your volume and minimizing ptosis or sagging of your tissue by maintaining your health over time, which would reduce the need for these kinds of treatments. And so, I'm a plastic surgeon. I do surgery on patients. I do injectables as well, just like you. And it's not that those things are bad. Therapeutics have a place. Lasers and other energy-based devices, they have a place.
Hi, skin friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to have not a board certified dermatologist, but actually a board certified plastic surgeon joining me, Dr. Cory Goldberg. And he is board certified in plastic surgery in both the US and Canada, although his practice is in Toronto, Canada. But what we are going to talk about today is how we find a lot of our patients and a lot of the press out there act like beauty is just skin deep. And I'll even take it further to say that beauty is just what your face looks like. And as dermatologists and as Dr. Cory Goldberg, as a plastic surgeon, know that beauty is so much more than that. We can do a lot to help with people's appearances, their skin health, texture, laxity, and things like that. But real beauty and true beauty really comes from the inside out. And that is more than just a pithy little saying. It really is true. To have optimal beauty, or what Dr. Goldberg calls beauty span, you really have to take care of your body. And it's really never too soon to start. That involves eating a healthy diet. He is a vegetarian. I really enjoy a plant-forward diet, and I have for many, many years. Exercise, moving our body, weight training, cardio, all of that, and making sure that we have healthy habits, not smoking, not tanning, sleeping enough, minimizing alcohol, all of that stuff. That's not really sexy, but it's so important. And simply by doing these things, making good habits, especially if you start early, it really will add up and it will help keep you healthy and beautiful for long. It will give you that longevity that a lot of people are looking at. And honestly, it will probably keep you from needing to do a lot of procedures and treatments down the road simply by being proactive with your health. If you are interested in expanding your beauty span, you are definitely going to want to check out this episode. Dr. Goldberg, thank you so much for being here. I am thrilled that I get to have you on my podcast because I had a lot of fun when we did our Instagram Live a couple weeks ago.
It is absolutely my pleasure, Dr. Mina, and I enjoyed our conversation and definitely looking forward to our further discussions today.
So you're a plastic surgeon, as I mentioned earlier, and you're board certified in the US and Canada, so you get kind of unique perspectives. I'm here in the US as a dermatologist, but I love talking to my colleagues in other fields where we have overlap and we treat the similar things because we always come at it perhaps at a slightly different approach. And I love to get perspectives from my plastic surgery colleagues. So I think this will be a lot of fun.
Yeah, I agree. And I feel the same. I learned so much from my dermatology colleagues, and we do have slightly different approaches to things. Different approaches ends up better care for patients and new approaches and innovative ideas. So yeah, definitely looking forward to our conversation.
I think that nowadays we realize there's so much overlap, right? Like you do a lot of surgery, yet you know the importance of skin and if the skin is healthy, right? Like that has got to impact your surgical outcomes, right?
Oh, for sure. When I started my practice 17 years ago or so, I don't think I really appreciated the impact overall health and quality of skin made on surgical outcomes. And, through residency, you always encounter those patients when you're operating and tissue is just not good quality. And in surgery, poor protoplasm. When someone's tissue doesn't operate well or it bleeds or it's very fragile, you say, oh, this patient has poor protoplasm. And, at this point, I now look back and I recognize what that means is they have poor quality skin, they have poor quality tissue, and it usually amounts to lifestyle and general health that causes that.
This is something we talked about previously on the Instagram Live. And I really am trying to like shout this from the rooftops that really our skin health is whole body health. And I think sometimes in our culture, we want to just buy a product, slap it on, and get amazing skin. But I really feel like really good skin has to start from within, and that actually our overall physical health and really mental health, right, is reflected in our skin. Do you sort of feel similar ways?
Oh, absolutely. I completely agree. And it's so funny, people think about skincare purely from a topical point of view. And as you said, you slap something on and you think that you're good. It's so much more than that. The next step past that is people recognizing that the skin is an indicator. It tells you it's a visible entity that you can see what's going on the inside. And that's absolutely true. But I would go even further than that. More and more, it's becoming very clear that the health and well-being of your skin isn't just an indicator of what's going on inside. It actually is a very powerful driver and determines very much your whole organ, your whole body, your organ health. And so taking care of your skin really amounts to taking care of all of you. I think that people they really sell skin short and they don't recognize the impact that it has.
That's wonderful. I'd love to delve into that more. I joke that people think your skin is your face, right? Not even your neck, not your chest, not anywhere else on your body. It's just your face and what it looks like, right? So, how does our skin impact the rest of our health?
Well, there's lots of different ways that the skin is connected to the rest of us. But, one very direct way that I think we spoke about a little bit in our Instagram live was that, the presence of senescent cells in the skin. And senescent cells, as you know, there are those kind of dormant cells that don't reproduce, they don't copy themselves, but they're damaged and they secrete all kinds of harmful substances and proteins, and that harms the tissue around them. These senescent cells that we have in our skin, they build up over time and they also accumulate from sun damage. There was a study that was released that showed that even 1 hour of sun exposure is enough to measurably increase the number of these senescent cells in the skin. And these senescent cells, people often call them zombie cells because they secrete substances that harm cells around them and actually make them also become these kind of dormant, harmful cells. And even worse yet, these senescent zombie cells, they secrete substances that get into our blood and it can be traced and actually it harms every other organ in our body. So, 1 hour in the sun amounts to these senescent zombie cells building up in our skin, and those secrete substances that harm our heart, our kidneys, our lungs, our brains. And so, really, sun damage, chronologic aging of our skin, and poor management of our skin then results in these senescent cells harming the rest of us and actually aging our whole body. So your skin in that way is directly related to the rest of your body and health and aging.
And you don't have to tell me twice about sun protection, right? I talk about it all the time. Sometimes I feel like I'm a broken record, but yeah, we used to think that the sun just caused mutations in our DNA and could cause skin cancers and also increased breakdown of collagen and elastin. So now it's really amazing to know that it's actually contributing to these zombie cells that are not just inactive cells, they're actually active in a very harmful way that sending bad messages. They're sort of like that bad friend that you don't want your kids hanging around with, right?
It's that toxic friend that you try to keep your kids away from because they're going to cause problems. That's it. That's what those cells are. These senescent cells are one way that our skin affects the rest of us. And, you mentioned the sunscreen, sun and sun protection. And of course, you and I are both on the same page as far as that goes. And, historically, everyone talked about wear your sunscreen to prevent your skin cancer and the DNA damage that causes skin cancer. The sun protection goes so much deeper than that. It's interesting that the ultraviolet radiation and the radioactive particles and waves that come from the sun, they actually don't directly harm our skin very much. In fact, 90% of the sun damage that we accumulate is related to oxidative stress that is being caused by these radioactive waves, by these, UV and other types of radiation. The particles of these, UV rays, etc., as they go through our body, they actually are very unlikely to hit the molecules in our DNA strands and such. Most of our molecules, most of our cells, it's actually open space. So these waves, they pass through us, but they leave behind them a trail of oxygen-free radicals, this oxidative stress. And that trail, those oxygen-free radicals, they are the ones that cause 90% of the damage from the sun. So in fact, it's not directly from the UV, it's this oxidative stress that it's causing. And so that's a huge driver of damage to our cells. That's the thing that's causing the DNA damage that's causing cancer. It's the thing that's contributing to the accumulation of these senescent zombie cells. So the sun is the ultimate cause But the mediator, the thing that's actually in between causing the harm, is oxygen-free radicals. It's this oxidative stress.
It all adds up, right? I mean, I know squamous cells are particularly prone to that DNA damage. And this really shocked me when I was a resident that the melanin in our skin actually forms like a little cap around the nucleus of our cells to protect our skin from the sun. And that's what a tan is. So, a tan is actually your melanin, the pigment in your skin, trying to protect that nucleus that has your important DNA. And yes, free oxygen or free reactive oxygen species, that's what things like vitamin C serums are trying to fight. That's why we say eat lots of fruits and berries to help with antioxidative properties. So that's a really great point.
So it's so important having the antioxidants in your diet and trying to keep up your protection from oxidative stress. And the melanin cap around the nucleus and the protection. It's amazing to me to hear people talk and say things like, "Oh, I go to the tanning salon so that I can get a base tan, so I can protect myself when I go away on vacation." When I treat patients with breast cancer who have had mastectomy and required radiation therapy, the radiation is done. You can see the tattoos on the chest where it's been done. And there's a square that you can see the skin is browned. And why? It's because it's been exposed to radiation and it's developing the same thing. So, why is it we recognize the harm from radiation from treatment for cancer, but yet if we expose ourselves to radiation from the sun, somehow many people still think that this is not just okay, but it's somehow protective and good for us. The thinking is changing, but needless to say, this is what we're trying to get out to other people so they understand.
I wonder if it'll be like smoking in 50 years, right? Where we're like, well, yeah, maybe not such a great idea, right?
So true. I think that smoking, sun protection, and alcohol are all going through the same transition. Everyone is recognizing the long-term harm that these things are causing. And, it takes time to have cultural change and recognize that, but it is changing. I mean, people wear seatbelts now. Smoking is not so common anymore. So the public message is getting out there, and I think that we're winning the battle. It'll take a little bit of time to get all the way there.
I feel like this push for longevity. People don't just want to necessarily live longer. I know I don't want to just live longer in poor health. Like, I'm really looking for how do I increase my health span? And to me, that's longevity, right? If someone's coming to you for a procedure, maybe even like a facelift, right? A pretty big procedure, what are things that they should be doing, or even before they come see you, right? Like, what are things you wish your patients would do 10 years before they come see you for surgery to help their skin heal the best from their procedures?
It's an excellent question. And, honestly, as you said, it's not just at the time of the procedure. It's not even just 10 years before. Honestly, 20, 30 years before. There's no time in your life where it's too early to start prevention. Heart disease and skin cancers, they start when you're a teenager. It's a cumulative effect. You've seen this 1,000 times before, I'm sure. The person comes in, they have their first basal cell carcinoma or squamous cell carcinoma, and you tell them, look, you have a skin cancer. We're going to need to remove that. And the shocked look on their face in the 50 or 60-year-old, how did this happen? I haven't been in the sun for the past few years. And the explanation, this started when you were a teenager. From my perspective, for that facial rejuvenation patient, that person coming to me for a facelift, when they're in their 20s, they can start doing things that will help to keep them healthy and stave off needing those kinds of procedures until later, and also make sure that at the point that they decide if they want to do that, that they're going to heal the best way possible. And those are the most very basic things. And I actually spend time talking with my patients about this. And these very basic things start with diet and a healthy lifestyle with good exercise. I'm a biased person. I want to be very, very transparent. My bias is I am a plant-based person. My wife and I have been, I don't say vegan because it's a very ethical and hardline position. We are plant-based. At least 95 to 98% of our calories come from the ground. And I feel very strongly about that because that is a very good way of reducing oxidative stress. And also the amino acids, the building blocks of the proteins in animal protein actually are really harmful for us. It's a big driver of diabetes and heart disease and oxidative stress. So a plant-based diet, and this is an observation I made 7 years ago or so when I became plant-based. When I started asking my patients the question and going through this with them, I recognized that those people who were plant-based, when I operate on them, their tissue operated differently. They bled less, the tissue held stitches better, the planes, the things that are meant to open as you dissect and lift things up, they open easier. The tissue is better quality. And it was so clear to me. It's amazing that I didn't recognize it prior to that, but it was because I never asked the question. So when I talk to my patients, I really talk to them about trying to lower their protein intake from animals, make sure they keep their protein up and look for it from plants. So plant-based diet, which reduces the amount of oxidative stress that you're taking into your body. And then the other one is a healthy lifestyle and exercise. 20 minutes a day of cardiovascular exercise, strength training to maintain your muscle mass. Your muscle is an endocrine organ. It's a hormone releasing organ. Over 30 hormones come from muscle. It is a huge driver of brain health and skin health both. So, the strength training and cardiovascular training absolutely improves tissue quality. And it also trains your body to manage oxidative stress so that you can minimize it by controlling it. So, diet is a good way of reducing the amount of oxidative stress you're creating on yourself. And the exercise and training your body is a good way to get your body ready to handle it and manage it and mop it up better. Those two things put together, in my mind, that's like 90% of the battle. There's lots of other, pills and things you can add, but those two things, that's the core ingredients.
I agree, right? It's starting early. It's like saving money, right? In your 401k or your bank account. If you start early and just do a little bit, but consistently, that will make huge changes when you're in your 50s, your 60s, your 70s, etc. So I joke it's not sexy. It's not like a prescription I can write and give it to you or a pill to take, but it's so impactful. And the sooner you can start, the better, but it's never too late. So, start today. I totally agree about sort of plant forward. I was a vegetarian for about 27 years. And then this year I did start eating lean proteins. I still really prefer, I think, a lot of plant based things. And I do love fish, though, I have to say. But I find that really watching your sugar intake too is important. That I'll say here in the US, right? Sugar is in everything. It really is shocking. Stuff you don't even think would have sugar if you flip over the bottle. So that's something I've been really cognizant about looking at because we also know that sugar will create these things called advanced glycation end products, these AGEs, and that they make our collagen more brittle and break it down faster. And I would imagine that would also affect surgical outcomes.
Those sugars, they're everywhere. And then the high fructose content things as well, the combination of that and the effect on the skin, the brittle collagen. And of course, that's a huge driver of metabolic syndrome. And that, only worsens things and results in skin lesions itself. The seborrheic keratoses, those little barnacles of life, as we call them, those are the things that show up as a precursor to metabolic syndrome, these high sugar content foods, and it's everywhere. I mean, Canada is no better. We have the same kind of stuff here. One of the things that I picked up, I was at an amazing longevity conference in Singapore in the spring. Singapore, as has been called, the Blue Zone 2.0, because it's the first place in the world where now there are more centenarians, people living to 100. And that's been developed, it's been engineered. It's not one of the pre-existing places. And I mean, they've done a lot of different things that have amounted to that. But one of them for sure, the government has limited the amount of sugar that can be put into foods. And it's listed very clearly on all the labels. The government controls that. And in North America, we don't do that. And our populations are suffering clearly from, frankly, an addiction. I mean, they're addicted to the food that they're eating. When we eat sugars, as you know, it spikes our endorphins. It does exactly the same thing that opioids do. We are addicted to our food and high sugar in the same way that someone could be addicted to opium or heroin. And getting people off of that is hard, but it is absolutely necessary because it's killing us and it's causing sickness, but it's also causing the aesthetic changes we see in our skin. I mean, people come in asking for beauty. Their diet is such a direct driver of what they could do to really improve that and prevent these issues in the first place.
I wholeheartedly agree. And yet I have a sweet tooth myself. So I get it. It is an addiction. And it seems like we get kids hooked earlier and earlier. I'm even babies with sweet stuff. And it's really hard to break that cycle. But we have to, right? Because it really legitimately is killing us. So it's a great point to bring up. Do you think the beauty industry properly addresses skin and beauty, or do you think we need to do a better job with that?
You hit the nail right on the head with the question. I think that the beauty industry is missing the boat a bit. And I have the same criticism of the healthcare industry in both Canada and the United States. We've suffered from the same underlying core issue. And that core issue is really we wait for something to be broken and then we try to go back and fix it. When someone has a heart attack, for the past 20 or 30 years, they've been developing plaques that are a risk for that. And the right time to prevent the heart attack isn't the day before, it's 30 years ago.
Or the day after.
Beauty is the same thing. For someone to wait until their skin is like a crocodile and then come to me for a phenol peel, I love doing phenol croton oil peels. They are spectacular. But the reality is there's so much that can be done that would prevent the need for someone getting to that point. And the same thing goes with the fillers that we're doing. There are ways of maintaining your volume and minimizing ptosis or sagging of your tissue by maintaining your health over time, which would reduce the need for these kinds of treatments. And so, I'm a plastic surgeon. I do surgery on patients. I do injectables as well, just like you. And it's not that those things are bad. Therapeutics have a place. Lasers and other energy-based devices, they have a place. I think the thing that's wrong with the system in beauty is that we look at those as the only way of taking care of someone. And we wait for people to walk through the door and give them as much as we can. And I mean, there are lots of other places that are, maybe not as ethical as you and I would run our practices, that they give people as much as they'll take and put in as much filler as they can. And the bias there is to sell as much as you can because that's the profit driver. What that amounts to is indiscriminate treatment, treating things that are already broken with absolutely zero thought or care given to prevention. And I just don't think that that's the right thing. So, I think that we need to focus more on preventive care, personalized care with, care for someone's genetics and epigenetics and knowing what they truly need to maintain their skin health. And I also think that we should be minimizing our treatments to a level that achieve natural results and avoid overtreatment of patients. Everybody's seen those nasty pictures of overtreated, people with tons of filler or terrible amounts of surgery on their face. We all know who those people are. It's sad for me to see that and to know that our industry has driven that. I think that we have a moral responsibility to help people come back to the natural and normal side of beauty and also try and prevent and help people before they get to those points.
I think, again, the goal too is not to stamp out any sign that maybe you're getting older or every single wrinkle on your face and every pore. Like that doesn't look normal either, right? So, as sometimes I'll see someone who's older and they have wrinkles, they have some loose skin, but there's something about them that's just beautiful. And I feel like probably a lot of people have experienced that beauty is not necessarily looking ageless and having the fullest cheeks ever, but I do think really it's in the eye of the beholder. So everyone's going to have a little bit differing opinions. But I think they've shown, like, even throughout the world, I would say beauty is just when you're healthy and you glow and having an even complexion. I would say that's been universally shown to be an indicator of beauty, but it's not necessarily making sure that your face is as tight as can be, that you have no sign of a wrinkle anywhere in sight. To me, that doesn't look normal. And I'll tell my patients too, like, I'm sure you'll find someone who will say yes and take your money and do what you're asking, but it's not the right thing for you right now. So I do think people need to be careful. There are a lot of people willing to give you as much filler as you're willing to pay for, or any laser that they have, they'll try out on you, or whatever procedure that you want, but it doesn't always mean that you need it or that it's really the best thing for you.
It's so true. And it's a funny thing. There's this bias, and of course, there's an inherent bias because these businesses derive profit from what they sell. So there's a bias to sell more, and of course, patient care needs to be prioritized. But there's that bias to do more. But then there's also the additional premise of, well, if someone's asking me for that extra vial of filler and I don't do it, or they're asking me to do that, second or third or fourth or fifth facelift or whatever, if I don't do it, they're going to go to the person down the street and they're going to do it. And, I'm a better clinician, I'm a better surgeon. So, it's better that I should do it, rather than someone else. That mentality, those biases have led to immense amounts of overtreatment and indiscriminate, surgery. And it's really shifted the concept of beauty. I mean, what is considered beautiful today is not the same as what it was 20 years ago. And while the vision of beauty has changed, I mean, if you rewind 100 or 200 years, beauty was different. I mean, it does evolve, but at this point, it's not just evolving naturally, it's being driven by practitioners in our industry. Ethically speaking, I am very concerned about that. I don't think that that's right. We are meant to be responsive and help to create beauty for people based on what the social norms are. We are not meant to be drivers or creators of what that should be. And one other thing that you said that it really struck me The idea that you should be ageless or completely wrinkle free, it's not normal. But people focus on those specific things because that's you could treat, if you look at someone and say, well, fuller lips are attractive. So if we make full lips, you'll be more attractive. Okay, well then you put some filler into the lips and then the lips may be bigger. But does that fit with the rest of the face? Maybe not. Suddenly you've made a feature that seems more attractive but doesn't fit with the rest. It's out of balance. So you have these people who, item by item, if you look at their lips or their nose, well, that's a really nice rhinoplasty and very well filled lips. But you look at them and they don't look attractive. They just look pieced together. You can't think of beauty that way. Beauty is holistic. It has to be your whole face in balance. And absolutely, there's no such thing as perfection. Some wrinkles, some irregularities, some asymmetry is normal. Trying to get around that, it will make people look funny. And so people are asking for the wrong thing. And it's up to our colleagues and us to, tell them that's not the right objective. Here's where you should stop and you still look natural.
And see someone who's willing to tell you no, because I see it too. And I joke with my staff, like, you gotta, like, tell me when things are getting crazy. Because if you focus on you're always filling your lips or your cheeks, you forget what you used to look like. You forget what your baseline was. And then all you are focusing on are what they look like now, fix it, fill it, plump it. That's when it starts getting bizarre. So I always also tell people, go to someone who you've seen their results, not just the pictures online, right? Because we all know with certain lighting and stuff like that, it can look different. But if you actually know someone who's been and you've seen them in person and you like their results, then that's a good sign. And also look at what the people in the office look like. Do they have the sort of aesthetic that you are looking for? Because if they look different than you want to look, you got to be careful because that's sort of the look that they have.
Yeah, I agree. I think that's very good advice. And I'm very particular about that in my practice. And I'm sure you are as well. Anybody that I hire that is going to be providing treatments for patient, one of the things I'm judging them on is their own appearance. And I always make sure to keep them on the right side of, therapy, because if they go past that, they are unquestionably going to be doing that to my patients. And I don't want those kinds of things happening. So if you walk into somebody's office and one of their, nurses or estheticians look overdone, I would suggest turning around and walking out, because that's the way you're going to end up looking if you keep going to that place. And, your comment about that kind of slippery slope of over time, you don't kind of remember what you look like. It's very true. Studies on brain look at cortical plasticity, the sort of rewiring of your brain. Your self-image can rewire completely in 6 months. So if you inject or do surgery on somebody for the first 6 months, their brain, when you look in the mirror, you don't register that it's you. I've had people who say, I look in the mirror, I don't recognize myself. It's true. After 6 months, there's actually a remodeling of your brain and your self-image changes. It rewires. So that's a slippery slope of filler. 6 months later, you're like, I don't see anything in my lips. The product is completely gone. No, it's not. You put another vial in there, now your lips are getting bigger. 6 months later, you're going to come back and say, oh, the product's all gone again. I don't see it. That perpetuates. That's what causes these massive overfilled patients. They're facial cripples. I mean, people come to me and those people, I dissolve them and I make them wait at least a year before doing anything. But I mean, it really makes me sad to see people who have gotten to that extent.
I would love to know, with the new year here, 2025, what are some trends that you think we'll see with plastic surgery, either things that are coming or maybe going away?
I think in the new year, we're going to see more naturalization. I think overall the industry is starting to normalize. So I think that that's a great direction. One of the things I think that's decreasing a fair bit is fat grafting to buttocks, the Brazilian butt lift. So, I mean, straying a little bit away from face, but Brazilian butt lifts were the big thing. I mean, started in the past 20 years. That whole, J-Lo and, big buttock phenomenon, I think that's changing. I've definitely seen changes in the industry. I think that's decreasing and sort of normal proportional buttocks are now in. So I think that that's a big one that's changing. I think that there's also a shift. More people are looking towards long-term correction with surgical interventions and asking for the non-invasive stuff less. And so I think that there's going to be a sort of normalization where we have the sort of non-surgical aesthetics maintaining and not sort of overdoing things, and people graduating to surgical treatments for, at their discretion, of course, when it's the right time. So I think that there's a bit of a shift more towards surgery. And, one of the things that I've seen a lot of in the past couple of years that's definitely increasing is upper lift. So upper lips, over time, they tend to lengthen and droop, and it covers the incisors of the teeth. So when that happens, it's actually an aging phenomenon. Lifting that up is now getting to be more and more common. I would say, probably 20% of the facelifts I do an upper lip lift. I have lots of people asking about it. And so that's definitely a procedure that's kind of come onto the scene in the past 10 years or so. Before that, it was much less common. So I think that those are a couple of the trends I see coming through plastic surgery.
I love a lip lift, a surgical lip lift, because I find my older patients want big lips, but it looks bizarre when you fill their lips, but they have that long philtrum. What they really need is not filler in their lips. They just need that lifted a little bit. And so I think I'm glad to see that because I think that's also contributed to some of the abnormal looks we've been seeing is that these older women with very full lips, but they're just kind of hanging down. So, yes, let's hope so. Well, Dr. Goldberg, this has been a lot of fun. I know listeners are going to want to follow you and find where you practice. Can you share some of that with us?
I practice in Toronto, Canada. I'm on Instagram at Dr. Cory Goldberg, MD. I also have a website, beautyspan.com. Beautyspan.com is my effort to sort of bridge and bring together the healthy longevity with the aesthetic industry and bring some of these principles into practice. Find me on Instagram or beautyspan.com for more information, and we'll be starting up a newsletter on that site soon.
Amazing. Well, I will definitely include all of that in the show notes. And I have to say, you are definitely my best dressed podcast guest. For those who are just listening, he's in a tux here. I don't think it's for me, though. I think he's got an event after this, but you look great. And thanks so much for being here. This was a lot of fun.
Thank you so much, Dr. Mina. It's really been a pleasure and looking forward to our next opportunity to catch up.
Sounds good. We'll see everyone next week.